So today we're going to talk about what's going on in PA and some of the things that we kind of do. Kind of our goals are to support what kind of supports are available in Prince Albert and surrounding area. I'll talk a little bit about women in corrections because I do spend one afternoon a week out at the women's jail. Talk about the women formula and some of the things that we may do a little bit different. And I know as Mary talked about Access Place, and we hear a lot about Access Place. So really, what is Access Place? Oh, if I can get this thing to work now.
The right side.
Oh, thank you. Whoops, back it up. No. We'll get it, yeah. So there we are, Access Place. And why we really called it Access Place was a name that we kind of come up collectively about. And it's about making sure people have access to the services that they want or need, based on their need, not our need, to make sure people have access to a variety of services. We're in Prince Albert, of course, right beside the bus depot, below Addiction Services, which really helps with our partnership because we can, Addiction Services, if someone wants to, will come down, kind of east of the bus depot, and how you get there, you walk through our door, and kind of the sort of the numbers with our, for our main phone number. Oh, you silly thing. No, there we go. So in 2014, within our health region, we were recognized with the distinct award of being the best healthcare team in our health region. So that's kind of our crew. You can see kind of, and we had to dress up because it was a formal dinner. It was quite bizarre because we don't dress up. So that's kind of, so we got the Better Care Team Award there. And kind of that kind of statement, from the PowerPoint, and I'm not going to read it, really says that we are really committed to providing quality health care to a variety of people, regardless of where they come from, or who they are, or their nationality or ancestry backgrounds. It's just how do we get you there? We're always striving to reduce the stigma around drug use, around HIV, and around women and pregnancy. I remember being told when I first got to PA was that all women with HIV that get pregnant should have abortions. And that actually came from a nurse on maternity. I work quite closely with that maternity now, and that has changed. So we work very hard. So we are at Positive Care Program, which is our HIV Hep C program. And as you can see by our list of doctors, they come from Saskatoon, including Toronto with Dr. Mona, who does clinics at our office. And it's always at our office. People don't go outside. The doctors come to us, and that's where the clients seem to want to be. We have an HIV nurse clinician, and the contact numbers are there, Hep C nurse. Our sexual health clinic is there, who does all of the testing for HIV, Hep C, treatment. They do some outreach and education. And it's kind of neat because when they test with HIV, and if someone has a positive result, they come and get me. So I am there when, right after the person gets the result, to kind of deal with some of that and making connections and plans for follow-up just to meet them and monitor how they're doing. We have a nurse practitioner full-time, and of course our needle exchange. Our case management team, which is Nicole and I, and we struggle with the term case management. That sometimes means for us that something about an individual has to be managed. So we try and work on it. It's just a support team, and what is it that they do. There's our contact, and of course our peer project that Mary talked about. We also have elders and spiritual advisors around through our peer project. So if someone wants to speak to someone, we try and coordinate whatever an individual wants within our organization. So then we have the gate, which Mary works out of, which provides nutrition. It's kind of drop-in, and it's crazy in there. And we quite like having the gate there because they have a stove, and they do lots of baking and cooking, so it kind of permeates through our office space. So we're always running, okay, where's the cookies? Or where's the muffins? Where's the cake? So we're kind of all there. So, and then, of course, the support for the peers. And our peers do a great job of referring people for testing and bringing them just down the hall to get tested and stuff. And it's great to have them there. So that's kind of, and we really can't do any of our work. We have some great partners in Prince Albert. Of course, our first one, if we're talking about pregnant women, is Family Futures, who provide milk and work quite closely with our HIV positive women, and they provide transportation. They're very good. We have a housing project in Homeward Bound And I spend 1 day a week. They're kind of in an apartment plus 15 houses, and they have a lot of our clients and some of our women in those complexes. So, and it's great because we can refer. They don't know that they're HIV positive. They just think they're at risk. And we go and see them, but we probably have about 20 of our clients housed through Homeward Bound, which makes easy, stabilized. As Mona talked about, an individual who had housing, her and her partner used to live in a cardboard box. They're now both, they're housed on methadone, on antiretrovirals, gained weight. It's amazing to see their progress in a short period of time. So then we work quite closely with our methadone clinic, which of course Dr. Lanois is one of our lead prescribers. And it's really easy to try and find, like if a woman's HIV positive and pregnant, she will take priority. It's one phone call. And if they can't get there, we'll take them, either Nicole or myself. And if we can't find somebody, if they're on methadone, we can usually work with them. We have client consents. We'll call them and say, can you get a message to so-and-so? We need to see them. And we work quite closely with them. Of course, addiction services. Our pharmacy is very good at calling. If we need to find somebody, we can get a hold of them. But if there's someone that's not engaged in care and struggling that we haven't seen, they're very good at calling me, and I will go up and meet them at the pharmacy in a private room and do some work and trying to reconnect with those that have been lost. The Victoria Hospital, we do lots of work. Nicole does rounds 2 days a week. And then I didn't mention is our obs and gyne specialist, Dr. Stevenson and Marcia in PA, who will, if we're having trouble getting someone in to see them as a woman who's pregnant, and if we manage to track them down, I make a phone call and it's immediate. I don't care how busy they are, they will take us. And Dr. Stevenson really wants to specialize in women and HIV, and she's doing an amazing job. So we really quite didn't get through that. So that's kind of who we are. We work inside our region and outside of our region because we are close in Saskatoon. So we have Black Lake, Laloche, Meadow Lake, Nipawin, Tisdale, Melfort. And in some cases, we're driving to Melfort, Tisdale, or Nipawin, or out to a First Nations community to pick someone up to take them for their appointments, to make sure they have access to what we're doing. So that's kind of, you know, we do, it's always holistic. I come from a place of I do nothing until I'm asked. Probably the best question I'll ask them is, what is you need my help with today? And trying to work through some of that. Client-centered, we're equal. We're not better than them. They are our leads, and without them, we have no job. And we always have to constantly reminding people that these are people with HIV, and these are our women with HIV. And then support and education for the newly diagnosed in and around our areas. So just because someone is diagnosed, we've had people bolt out of our doors. So then it's a matter of going out and trying to find them on the street. And I've had some clients say, okay, meet me on the corner of First right by the A&W and we can go for coffee. Okay, but I'm not going to be there till 6 o'clock tonight. Okay, doesn't matter. So how do we get that? So that's kind of the questions that we do. So we're going to share some of our personal stories around some of the work that we do in PA and what support really means. For us, it's about what is it, you know, we've got doctors and nurses in our clinic. They can take care of the clinical management of HIV, but what about the mental, emotional, and spiritual well-being of our clients? And that's kind of where I think Nicole and I come in, is we're looking after those needs, whatever that need may be at that moment in their time. Is that you tell us what are your goals or what do you need to help? And sometimes it's just a matter of saying to them, you know what, we're here. And we're not, if you don't want to talk about your HIV, that's fine. Let's talk about housing or your relationship. And if they're pregnant, what about dad? How's the father feeling? Where's the father in all of this? And being able to even to maybe work with mom and dad to try and coordinate some care. And with the women, issues of violence and all kinds of things. I just spent some time with a new HIV, and she was petrified to tell her partner for fear of being beaten. So we've made arrangements to have him come in, and I will sit with her. So I do lots of helping them disclose to their partners, their children, their families, to help sure that they have access to support and care. And if we're talking treatment, it's very easy, my experience has been, you go in and see the nurse and the doctor, and for some, those are people of positions of authority, although they try not to be. So I'm going to say yes, as Mary explained. Yes, I'm going to take my meds. Yes, nurse, yes, doctor. They walk out, they don't take their meds. So part of my work is to say, hey, are you ready for your meds? Do you know what that means? For some people, taking that pill every day reminds them that they're HIV positive. And they haven't come to a place of acceptance yet. So working from that perspective of how do we get them to do that. And if they're not ready, that's okay. Because some of our clients, I worked with one for about 6 years, tried every trick in the book I knew to get her to take her meds, including going over a couple of times because she was very sick and calling an ambulance for her. She refused to take the meds. But she knew. I did lots of education with her about, here's the benefits, here's not the benefits of your medications. You decide. I don't care what you choose, as long as that is an informed choice. If you choose not to take your medication, this is what may happen. If you choose to take your medications, this is what can happen. And for a lot of the women that are being diagnosed with HIV, I get this: nobody's going to love me. I'll never have a relationship. I will never have children. Kind of my life is, I'm just this being walking around diseased. So it's been able to work them through that process as well. And if they're treatment ready, finding ways that, what do they do every day so that they can be successful in putting their HIV to sleep. It's not my HIV, it's theirs. They're on it. So they are key in our role of providing support services to them. We have clients that are in the far north that I will phone once a week to check on them. I've got some that are very private that I have to sneak in our back door, put them in my office, because to get to the physician's office, you've got to walk down by a couple other offices. And the nurse and the doc will actually see them in my office just because they're that private, you know, for some of our women coming out of the north. And, you know, we've got, you know, people from the street. We've got professional women living with HIV in our communities, and they're all the same. And I ask them all the same question: how can I help you today? And the approach in supporting women with HIV is letting them know that they're special, and how do we instill some hope, and that I'm always there. I don't work 8 to 5 Monday to Friday. If they need me on the weekend, I'm there. If they need to phone me after hours, I'm there. If they're in hospital, I'm there. I visited patients who have been in ICU here, you know, just kind of wherever they need support, but it's also working with the women's families and being able to translate some of that medical jargon that comes down to work with families so that they're understanding. And, you know, so HIV just doesn't happen to the woman. You know, they may have a partner, they have a family, and they have a community. And how do we support communities when they're dealing with the issues of HIV in the communities and with the women, and if they have children. Oh, you can't hug your children. I had a grandma come in and see me, very distressed. Her daughter was diagnosed with HIV, but she had grandchildren, and she was very concerned about the grandchildren. So it was an opportunity to provide some education to the women. And then when they end up in jail, it's a whole other story. You know, we've got pregnant women in jail. I know of one that actually delivered while incarcerated, was taken to the hospital in handcuffs and shackled, put in a private room in maternity with guards sitting outside while she delivered. Baby was delivered. Within 12 hours, she was back in the institution. So, of course, we have the only women's prison there. And so some of those issues that we see on the outside, we'll see on the inside. I'm going to get my care while I'm in, as long as I'm in Pine Grove. So I'll go out and see them. They talk, oh, yeah, I'm going to, yeah, take my meds when I get out. What happens when they go to Yorkton? What happens, go to Regina? They get out and it's like, I'm right back. We send them right back to the environment that may have created the issues for incarceration to begin with. So they may want to do their stuff. They have access to, HIV treatment can happen while in jail. Blood work happens while they're in jail. And they may not use, kind of, while they're in jail. But also when they get out, they have a huge risk of overdose, especially if they've been in there for 3 months or longer because their tolerance is low. So I do lots of work with them, saying, if you're going to do this when you get out, do half of what you would normally do, because I don't want you to OD while you're, when you're coming out of the institutions. It's, the correctional facilities have great nursing staff. Unfortunately, some of them are on HIV meds, maybe going to a small community, and ideally we want them to have at least 2 months supply of meds. And we get a little upset when they get out and there's no meds. But the other part, nursing may not know when they're discharged, right? But they're women in that institution. They are bunked together, lots of fights. They may be put in segregation. I know the nursing staff at Pine Grove do an exceptional job of trying to coordinate care. If there's a new diagnosis out there, they will call me. So the correctional piece is, it's tough. I'm there every Friday afternoon, so I usually have about 6 on my list to see or to follow up and try and do some planning upon their release. If they do need appointments, I'm making appointments and those types of things for that. So that's my spiel, and I'm going to turn it over to Nicole, who is very good at what she does as well.
Hello, I'm Nicole. I'm the social worker at Access Place. I'm just going to talk a little bit about the infant formula program. And so what we know about the stats, what's out there right now, is that they're saying the breastfeeding increases the risk of vertical transmission by about 14%. So what the province developed was the infant formula program, which is to provide safe and appropriate nutrition to newborns and mothers living with HIV. And so in the positive care program at Access Place, we receive a referral whether mom walks in, gynecologist, hospital, sexual health. Some of the moms I know throughout pregnancy, and some I'll meet like during delivery, but right after delivery I'll be meeting them. And so we have the guidelines the same as in bigger cities, such as like the response for the formula. It's the responsibility of the parents to contact myself when they have approximately a week's supply left. Baby must be in mother's care to be on this program. If the child or children are apprehended, we are never done with our work. We're always working with the families, with the mothers. We're trying to unify the family no matter what, whether that's through counseling, through addiction services, and the other community agencies out there. So the formula will stop if a child or the children are apprehended, but we restart it when baby returns home. So in Prince Albert, we order through the dietary at the Victoria Hospital. It gets shipped to us at Access Place, and then typically we'll deliver to the mom's home. So what this does is it creates a really strong relationship. We get to see mom in her comforting setting of home, whereas, we're always in a clinical setting. So really important building those connections. Usually I say I work with Barb, and then they're like, oh, okay, and they're good with me. I've only been doing it a year, so I'm learning a lot. But really, building those connections keeps them more engaged and more willing to discuss HIV and treatment. Another valuable piece that we do is that we do provide all the transportations, you know, for prenatal care, appointments, and the RUH appointments for babies. And so I kind of got familiar with Nicole here, and we get to bring the babies to the appointments, and that's a kind of a time where we get to know mom. It's a bonding time, get to ask all questions in regards to the testing and that stuff. And what's really neat is the trust is shown with our mothers through, like, you know, the other time when I brought my mom over here to RUH and baby needed testing, they asked, what's the best way to reach you? And most times they put Barb and I's numbers, you know, and that shows a lot, you know, when we're getting testing results and appointment times and they're calling us, you know, it just relays the message, we're accessible, we're open, we got a comforting environment. And so a lot of times we just need to think outside the box. We'll get phone calls saying, hey, you know, mom has this appointment. And so we're thinking, okay, well, we know mom is on methadone daily. Let's call the pharmacy. Let's leave a message there and get them to call us back. Or, hey, we know she has a parent aid. Let's call that parent aid. You know, if we have consent, that's a circle of care, you know, that's who we work with. And Della said it correctly, the links in our community are the most important, and faces, and that's what we do. We know addiction services and be able to call, you know, for those appointments, pediatrics, family futures, all those, the parent aids, you know. Prince Albert's still fairly small that we can make those connections. We can, you know, and so it's really nice. And most of the times, we just go and do a home visit and relay the message ourselves. So we're doing a lot of like in-betweens. We're not always in the office. We are going out. Like Barb said, I've had a mom, I've had to drive to Melford, drive to Saskatoon, drive her home, drive back to PA. That's a long day, but you know, we feel really fortunate with our team. And that's the last thing I was gonna say. Most important is our team that we work with. And you know, Barb and I, every morning, we go through our schedule, we have to prioritize. We talk with our HIV nurse, our Hep C nurse, sexual health. We're talking who needs blood work and who's prenatals and who's doing what, and through our week. And that's kind of how we connect, and we're a really close-knit group. And that's what makes us work, so.
Yeah, and just to add to some of Nicole's stuff, she mentioned a bit of it. We do a lot of home visits into places where people may not think we should be going, but it doesn't matter, right? Nicole and I are both very good at recognizing, okay, this is not a safe place to go. I had trouble delivering formula to Mary because there's like a huge amount of stairs. So I made her partner come and get it. So we do deliver the formula and things. And as far as, you know, at Attack-A-Coop, I'm there one day a week, and we've got some mums out there, so I'm actually throwing their formula in the back of my Jeep when I go to deliver it, so to make it easier.
We'll just have higher successes if, you know, we build those relationships. And that's really where we begin. And a lot of times I am working on just basic needs and forms, and you know what? That's okay. That's where we're at right now. That's fine. And you know, I just hope that I get to work with this team a lot longer, and
Yeah, and I think it is a team. You know, it's a real team, and it's good to work with Nicole. She teaches me lots. But my best teachers are the women living with HIV. They teach me that all the time. And I know Mary really wants to work with pregnant moms with HIV. So we had a meeting at the OBS maternity ward in PA with Mary. They have her cell phone number, so if there's a woman who is newly diagnosed in labor, they can call Mary, right? She's the best one. You know, I can go, but I'm not living with this, so she's, you know, she's probably the best one, and I don't have any children, so I can't even relate. to some of that. But I know, our home visit and the team approach and working with Nicole is great because it's like, okay, we have a couple of clients that may be high needs and we just need a break, so it's okay, you have them this week, I'll take them next week. So there's no ownership of the clients, right? And there's no, oh, they're talking to you or they're talking, you know, we don't have that in our office, and it's how do we do the best that we can? And sometimes you get a little tired and and it's nice to have Nicole when things kind of fall apart or it's a little stressful, you go down, and we do the same, right? And discuss maybe some difficult cases in doing that. And then on clinic days, we're on the run, we're driving, you know, making sure people have access to what it is we do there. Yes.
Good. Thank you very much, ladies. I do have one question on the iPad here from a remote viewer. It says, Nicole, can you describe what you do twice weekly at the hospital when you go to hospital rounds? And are there always persons living with HIV in the hospital in Prince Albert?
Okay. I would say since our housing program, we've had way less people in the hospital, honestly. I do go twice a week I used to be part of the patient care coordinating unit there. And so I had a good rapport there. And so I go twice a week, morning meetings, huddle with them, and they have their acute care access program. Will hand out the new patients for the week. So I'm kind of a part of that. I get to see, you know, who's coming into the hospital, who may need my attention. So I will see Hep C HIV clients and connect with them, and if Barb's more familiar with them and they want to see her, that's fine. I'll go in and just touch base with them and say, hey, I work with Barb, and Barb will come see you later. so it's really neat. So I go there twice a week and I get to be a part of that. And I do rounds, so I will go if we do have any of my clients or clients in there. I'm using the word client, but I will go and be a part of doctor, nursing, physiotherapy, and what the plan is for discharging that client, and be a part of that.
Again, the numbers to text are 220-0462, and the numbers to call 966-8800. So feel free to ask questions that would be directed at this panel. I have a question, Barb. And Nicole, who are your contacts when you're talking about going to Melfort and Tisdale? Or do you just contact the client directly, or when we're looking at these more northern communities, La Ronge, do you have people on the ground that community workers and whatnot that you can be in contact with?
Some of the individuals will actually contact us directly, or through their health center will contact us. In some cases, it's somewhat, they get a little frightening about privacy coming in by medical taxi for fear they might be knowing what doctor they're seeing, or why are you going to Prince Albert. And we've had meetings with non-insured, and we are glad to say that they've come out with a policy that says they're just going to see a physician, not why. Click it, and that's kind of, so it may be individual, it may be referrals coming from communities as well. Yeah, and when I do support in First Nations land, Takakuba and Sturgeon and Big River, it's because I'm asked to go there. I just don't go there, right? I'm asked on clinic, like on Mona's clinic days, I'm there. In communities, I go because I'm asked, and we do that. I do lots of education as well. And I'll take Mary. Her and I have been in La Ronge, and we've been in Stanley Mission, just to do some really basic information, or how do you support people with HIV? So we do that as well, and eventually I'll get Nicole trained up and she can do some of that as well. Don't do a lot, but I think it's important that you work with communities as well.
There's another question about case management. So I know in some sites there's case management for HIV only, but in your site, do you do case management for those persons living with HIV and the persons that are hepatitis C that are accessing the clinic as well?
Yes, because there's some diverse people accessing our Hep C clinic that may need some. I know from an experience we had one that has some, we treated successfully from a community just outside of PA. But I had to go once a week and get her blood work and take her in because she was co-infected, but we needed to treat the Hep C. So yeah, we still work with, because some of them are dynamic, and I'm of the belief if we can work and slow down Hep C, because most people I know will get Hep C first and then HIV comes later. So it's kind of, if we can even do some work to prevent some Hep C, we'll prevent some HIV down the road as well.
Yeah, I'm sure your support increases their success rate if they're on treatment for hepatitis C as well, right?
Yeah.
So their adherence. Another question for Nicole. How do moms living outside of the three, Prince Albert, Saskatoon, and Regina, join the formula program?
Okay, we do have some mothers that are more northern. We have had a connection with pharmacies of their choice, and they can either pick up from there or we can ship by bus. Those are kind of how we do it, but it will go through us first, the referral, which is through the hospital. Yeah.
And also on the provincial website, the www.skhiv.ca, there's a link to the formula program and the 3 clinic sites. There is a contact number there too, so a person can self-refer and have a discussion with the social worker, which would be Shelley Glum in Saskatoon and Tanya in Regina and Nicole in Prince Albert, so that they can refer themselves if they happen to move here from another province and have a baby that's 2 or 3 months old. They are eligible to be on the formula program as well. So that's how they can access the program. Let's see. Someone wrote, okay, Mary, thanks so much for sharing. Was your partner, what did your partner say about the HIV diagnosis? When did you disclose, and what was the reaction there?
Oh, okay. Well, like I said, I met him in treatment, and that's where my voice is starting to go. Okay, he knew right from the get-go, because I spoke about it so openly in treatment, and even though he knew I was HIV positive, he still liked me. Now he loves me. I love you, John and Kyle.
Okay. Is access, and another question about access. Access Place is part of the health region, right? It's funded
Yes.
by the health region, right?
Yes, it's part of Prince Albert Park.
That was another question. And does Access Place have a website?
Through the, they can access it through the Health Region
website. Okay.
There's links in there to programs and services.
So that's the Prince Albert Parkland Health Region website, then does have a link to Access Place. It probably contact numbers, does it, Barb? Is that contact numbers? Yeah. Okay. Does anybody in the audience have any questions? Any questions? I think we have a couple minutes and we can go back to our question. If I could just ask Mona to come back up, and I won't embarrass you again, Mona, but someone did do a little bit of looking as to that drug that they were asking us about, and I don't know that we can talk to the drug, but I think we can talk to, maybe if you want to talk to what's out there on the website that maybe folks need to be wary about, because the answer to this was, the BARIIZ is a herbal drug approved by the government of Pakistan. Head offices are in Toronto. Apparently it, in quotation marks, cures or decreases the viral load. So it's just something that's out there on the internet. So maybe if you want to speak to that in more general terms. Sorry to put you on the spot.
No problem. I haven't heard of the drug. You know, there is lots of herbal or complementary drugs out there, traditional medicines that are out there. Many of them do have an impact on the immune system, and I'm not trained in complementary or traditional medicines or healing, but I'm supportive of it. However, in terms of HIV, the drugs that suppress the virus and have been shown to significantly prolong life are antiretroviral drugs. So what I always recommend is working hand in hand with a naturopath or a traditional healer, and I'll provide what I'm trained in, which is Western medicines and antiretroviral therapy, and the traditional treater and healer can provide their expertise on traditional medicine. So it's important to stress that the antiretroviral therapy is really important, and so and to not miss taking that portion as well.
Okay, thanks Mona for sharing. Sorry to put you on the spot. And I think we all need to be wary of things that are out there on the you know, on the internet. There's things that are not always factual. So if persons living with HIV or care providers have questions, those are certainly very valid questions to take to the teams at the infectious diseases clinics across and the positive living program, et cetera, across the province, and ask before picking up. Some of these can be very expensive. And you know, we're always concerned about, as Mona said, our drug-drug interactions. Next question is for you, Nicole. What are some strategies you have used to connect with clients? And that's a question from Meadow Lake.
Oh, okay. You know, I've always, when going to someone's home, and I've used this, you know, just even with friends, you don't just walk right in, waltz in, you know, have some respect. You know, I wait and I see if, you know, is this a good time? You know, you can usually sense people's energies, what's going on, how are they feeling, you know, and assisting with what's going on at the present moment. So, you know, is it transportation, or, you know, is the stress more something involved with, you know, their addictions? Do they want to connect with someone else? The biggest thing I always try to understand that they have a lot on their plate. They have a lot going on at this moment. It's not just about treatment or money, homelessness. A lot of times barriers are transportation, or no phone, or, you know, no ID. And so making those things a little easier, and just letting them know that I'm here. Whether, you know, I take a step back, like was it Della or Nicole? And Nicole saying sometimes you need to take a step back. Sometimes that's the way to connect as well. So.
Good, thanks very much. I just want to say, you know, how sometimes we can envy the fact that you're in a small setting and you can reach out. You know, in Prince Albert it's easy to reach, but you also have the unenviable task to try and support the north, which has a, you know, a vast geographical distance there. So I think what you do is very admirable. Now I hear another little question. Oh, okay, I'm getting a little note there. If you have a question and you're uncomfortable actually addressing it to us directly today, there is an email that you can, so it's contact@hivplt.ca. So you can certainly, you know, if you have anything of a question tomorrow, or later today, that, you know, a burning question, certainly send that off. And Amanda, who works for us with the Saskatchewan HIV Collaborative, will be glad to find the answer for you from, you know, she'll triage out the questions to the most appropriate source and get that question answered for us.